Hospice and Palliative Care of Westchester is so much more than you think.
We were really concerned about getting special care for her, and the facility told us that we had the option to get the care of hospice, and we were thrilled to know that.
We provide services for patients in all settings. And when they are in the nursing facility, we are fully cognizant of the fact that this is their home. So we are going to go in, assess that patient for hospice services, make recommendations for complementary care, spiritual care, provide a home health aide so that they can get services above and beyond what the nursing facility can provide.
Hospice care really adds a whole new layer of challenges to the staff. When a person is in a more critical medical condition, the presence of our nurses and social workers really enhances, it doesn't replace, but it enhances the services that are already available in the facility.
We understand that it's very important to come in right away and to assess their spiritual needs and to get in touch with their faith community or synagogue, have a priest or rabbi come to see them, and our ultimate goal is to really reestablish their hope and their connection to their faith.
Another part of my role, I think, is offering supportive counseling to the family, and that may take on different forms. It may be bringing family members together to facilitate some life review, and ultimately those processes are very healing for the family.
I think there are a lot of people that are surprised to know that in a facility they can reach out for hospice support.
We try to work as one family, the hospice and the nursing home staff. That's because, after all, we are really one team, and we have the same goal in mind, and that's the best quality of care for patients and their families.
To have our staff present often means that someone will express a concern or a difficulty that they're having. And I would say, if I'm looking at the volunteers in particular, the volunteers not only provide comfort, and sometimes they might read to the patient or play music to the patient. Certainly the goal of all of our staff is to make the patient feel that they have agency over their lives.
I think that now I understand that the mission of hospice really is to celebrate life, and in so doing, they bring a quality of life to people that are suffering or challenged. And that joy is passed along to the family, and it gives us tremendous comfort.
We as hospice staff members go into nursing home and work collaboratively with the facility staff by providing our expertise in pain management, symptom control.
While there are many families that visit regularly with their loved ones in nursing homes, there are also a lot of nursing home patients who are relatively isolated. So our volunteers provide a kind of socialization that would supplement or stand in for family involvement.
So the staff knows that the patients that we're taking care of that their spiritual needs are being taken care of, and I think they feel good about that.
And Terry was lying in a hospital bed and was completely unresponsive. And you can see now she's a very different person, and we owe so much of that to hospice.